Hi everyone! Welcome back to the channel. If you're a new parent or you're caring for a newborn, this video is for you. Especially if you're wondering, why is my baby crying so much? And how do I know what they need? Today we're talking about newborn communication behavior, and specifically, what to expect from one of the most common signals, crying. Let's get into it. First, the most important reassurance. Crying is how your newborn communicates needs and feelings. Newborns can't talk, so they use their body and their voice. That means crying isn't bad behavior. It's information. Your baby might cry when they're hungry, tired, uncomfortable, like a wet diaper, tight clothing, too hot or too cold, sick or in pain or needing comfort and closeness, or needing a change of scenery, like going from indoors to a gentle walk outside, or switching rooms to reduce stimulation. Sometimes babies also cry simply because they want to know you're there. In other words, crying can be emotional as well as physical. Here's another piece of reassurance that many parents find helpful. On average, newborn babies cry and fuss for almost 3 hours a day. And for some babies, it can be longer than that. You might also notice a pattern. Most crying seems to happen in the late afternoon and evening, but every baby is different. So your day-to-day experience may vary. Now, the next expectation is about timing. Crying often peaks around 6 to 8 weeks. And as babies get older, they usually cry less over time. Also, you may notice that the crying becomes more spread out through the day, instead of concentrated in the evening. It can become easier to understand what your baby needs. That easier part is real, because as you spend time with your baby, you start to recognize patterns. Let's be honest, sometimes it's still hard. When your baby is crying, it can feel like nothing you do works. You check one thing, and then they cry again. And the hard truth is, even if your baby isn't hungry, hurt, or sick, crying can still happen. Babies can cry because they need soothing, connection, or simply a calming routine. So instead of thinking, "What is wrong with my baby?" try thinking, "What is my baby communicating right now? And how can I help them feel safe?" Even if you can't immediately find the exact cause, it's still important to comfort your baby. Comfort is not spoiling. Comfort is communication. It helps your baby regulate and feel secure. Here are comforting ideas you can try. Cuddling or rocking your baby, taking them for a walk. Gentle movement can help some babies settle. Baby massage, soft, slow strokes, only if your baby seems to like it. Changing the environment, like dimming lights, reducing noise, or moving to a quieter room. Skin-to-skin contact if that's something that works for your family. The goal isn't to be perfect. The goal is to help your baby calm down and feel that their caregiver is right there with them. One more important note, trust your instincts. If your baby has signs like fever, unusual sleepiness, or weakness, vomiting, repeatedly breathing difficulty, you can't comfort them, and something feels off. It's a good idea to contact a healthcare professional for advice. Most crying is normal, but safety always comes first. So today's takeaway is this. Newborn crying is communication. Your baby might cry from hunger, tiredness, discomfort, pain, or they may simply need comfort, closeness, or a change of scenery. On average, newborns cry almost 3 hours a day, often more in the late afternoon and evening, with a common peak around 6 to 8 weeks. And it typically becomes easier as your baby grows and you learn their signals. And even when you're not sure why, comforting your baby is always the right first step. If you found this helpful, please like and subscribe for more newborn parenting support. And tell me in the comments, what is the hardest time of day for your baby's crying right now? Afternoon, evening, or all day? I'd love to hear your experience. See you in the next video.